Hi, my name is Misty Hernandez, and I'm going to explain the arterial blood draw procedure. The first thing you're going to want to do is you're going to gather your equipment. You need a bag of ice to freeze the blood draw, keep it from clotting. You're going to need a needle with heparin in it, also to keep the blood from clotting. You're going to need some alcohol prep wipes to clean the area. You're going to need a piece of gauze and some tape or a Band-Aid to stop the bleed. The next thing I'm going to do is I'm going to check the patient's chart for the order and to make sure the patient's not on any anticoagulants or anything that will stop the blood from clotting. First thing you want to do is introduce your name to the patient. Hi, I'm Misty Hernandez. I'm with the respiratory therapy department, and I'm going to do an arterial puncture today. That's where we're going to take a sample of blood from the artery and check your saturation of oxygen. Can you please tell me your name and your date of birth? And I'll check the wristband to identify my patient. Next thing I'm going to do is I'm going to maintain asepsis and wash my hands. Now I'm just going to explain the procedure. I'm going to clean your area that I'm going to draw from, and I'm going to withdraw the blood. You're going to feel a slight pinch, but it shouldn't hurt too bad. So the first step on the procedure is to test for collateral circulation to make sure that both the main arteries going to the hands are working. So how you do that is you do an Allen's test. Okay, if you could just make a tight fist for me, Minnie, thank you. Pinch off both of the main arteries. Now I'll release the radial artery. If the blood flushes back into the hand within 3 seconds, I'm good to go, which it does. Now I'm going to check, the patient is on room air, so I'm going to document that as such. Now I'm going to go ahead and start with my draw. So I've opened up my kit, my needle, it's ready to go. I have my alcohol wipes I'm going to clean the area with. I put on gloves, mind you. I have my invisible gloves on. I'm going to clean the site where I'm going to draw. Now I'm going to feel the artery with my first 2 index fingers. When I get a good feel on it, I'm going to take my syringe. The bevel is facing up towards the heart, so that way the blood shoots in. I've lowered my syringe, mushed the heparin around. Now I have it on 1 milliliter, which is how much blood I'm going to need for the sample. With the bevel up, I'm going to let the patient know, okay, quick poke, in there and up. Got it on the first try, yay. So now you just move the blood around to make sure it mixes with the heparin so that way it doesn't clot. And then I take the needle off, I dispose it in the sharps container, I put the cap on, make sure all the air is out. Then I put that inside of my bag of ice to keep it from clotting. Now I'm going to take a sticker from the patient's chart. I'm going to label that. I'm going to put it in the dumbwaiter and send it to the lab. Next, also when I'm done, I have to make sure to put enough pressure on there. You want to hold it there for at least 5 minutes to make sure the bleeding stops. And then once the bleeding stops, I'll put a bandage on there and I'll put it nice and tight until the patient just hold it there for a while. Okay, now I'm done. The patient's bandaged up. I'm going to throw all my trash away, clean up the area, rewash my hands, thank the patient, and that's it.